Hello, and thank you for joining us today for this webinar on the state of your health, how new laws may impact you. My name is Mary Bartlett, and I'm a State Director of Advocacy and Access for the Arthritis Foundation. Arthritis Foundation Advocates have played a pivotal role in more than 100 state legislative victories across the country since 2014, including the new law on step therapy in New York. But what do those victories mean for patients and their access to care? The Arthritis Foundation has you covered as your go-to resource to learn more about the benefits of these new and improved changes in law. We're here to help ensure that your new protections are implemented fully and that patients in your state know their new rights. This includes providing resources like this webinar that explain the issue, the new law, and what it means to patients. The purpose of this video is to learn more about the step therapy law in New York that was fully implemented in early 2018 and what to do if you feel the law has been violated. First, let's define step therapy. Step therapy is a protocol or program that establishes the specific sequence in which prescription drugs for a specific medical condition and are medically appropriate for the patient are covered by a health plan insurer. We had amazing champions in the New York legislature on the step therapy bill. A huge thank you to each of those legislators. Now that there is a law in New York on step therapy, we want to make sure you know what that means. The law includes two basic patient protections that will improve the safety and efficacy of the step therapy protocols. First, it requires that clinical review criteria used by an insurer to establish step therapy protocols is based on science and evidence-based clinical practice guidelines and not exclusively driven by cost. Second, the bill requires a clear and expedient process with timelines of 72 hours or 24 hours for an emergency that can be used by physicians and other prescribers to request an override of a step therapy protocol. There will be immediate coverage for a prescription drug if the decision is made that step therapy should be overridden. Who benefits from this new law? The law applies to state-regulated commercial health insurance plans, HMO plans, Medicaid managed care plans, and Child Health Plus plans. The new law does not apply to Medicare, Medicaid fee-for-service, or self-insured plans, which are exempted by the Federal Employee Retirement Income Security Act of 1974, also known as ERISA. To learn if you are covered, contact your insurer and provide your policy number for plan details. What do you do if your prescription is denied? If your medication is denied because of step therapy, your insurance won't cover the prescription. At this point, you may want to talk to your pharmacist and healthcare provider about the alternatives that would be covered. You can also decide to pay out of pocket, compare discount cards, cash prices, and assistance programs to determine what works best for you. When starting the appeals process, ask your pharmacist what they heard from your insurance company and write it down. Then, call your doctor and report the problem. See if they can suggest next steps to get your medication. Call your insurance company and find out how to appeal the decision. Your physician often needs to intervene or write a letter. Share copies of any insurance letters and information you receive with your doctor. Make sure you stay on the same page. Here are some tips for working with your insurance company. Check with your Human Resources office to learn the specific rules of your plan. Check to see which measures your physician has already taken with the insurance company. If nothing has worked, you may need to appeal the insurance company's decision. Call your insurance company to find out why your medication did not receive approval. The number to call should be on the back of your insurance card. To find out if your appeal needs to be online or there is another process from your insurer, they should be able to provide this answer on the phone. Be sure to keep notes of all the conversations you have, who you speak with, dates and times of calls, case reference numbers will all help. Having good records moves future calls forward. Stay in touch with your doctor through the process and share any information you receive. Your insurance company must provide the reason for your denial in writing. Ask about that if you have not received anything. If submitting an appeal yourself, include all relevant documents that may help your case, including letters of support from the physician, test results, or your personal narrative. But what do you do if your insurance company is non-compliant? The next step is to file a complaint with the New York State Superintendent of Insurance. Here we've provided the website and phone number to reach out to them. But remember, before you can request an external review, you must have completed the internal review process provided by your insurance company and received a final decision. If you have any questions or need additional information, all of our resources will be available on the Arthritis Foundation's advocacy webpage. If you have additional coverage questions, we encourage you to visit Your Coverage and Care through Prescription for Access. This go-to resource will help you better understand coverage options, determine how your current plan meets your arthritis care needs, and guide you through the claim denial process. This kit includes information, tips, and tools for consumers to get the most coverage and avoid or minimize claim denials. This kit includes step-by-step instructions, sample letters, and consumer assistance information to guide users through the appeal process. Additionally, the Arthritis Foundation's helpline provides people with arthritis, especially those most vulnerable, tailored solutions to inquiries about arthritis and its management. The phones are staffed by licensed clinical social workers who provide expert answers to questions about access to healthcare, information about resources to pay for medication, and community resources. Thank you for listening to today's webinar, as we want to make sure that new state laws are being implemented fully so patients can enjoy their new protections.